African Press International is privileged to get the opportunity today to interview Patients Ombud, Mr. Knut Fredrik Tone, whose duty is to ensure that complaints by patients against medical staff in Norway receive the necessary attention that benefits the patients one way or another. Mr. Tone, baby Evans, whose mother, Martha Wangui Kiru, came to Norway in 2007, died last year, barely 1 year old, in the hands of the hospital staff in Akershus University Hospital on the 20th of April 2011. What have you found out about his death, and who specifically can you say is to blame?
Well, the health board has found that he was dying of thirst. He didn't get the proper medical care during the stay at Akershus, and because of that he was dying. They have also said that the hospital has broken the law. They haven't had the right and proper what should I say? It's not one person who has done something wrong. It's several persons. So the system hasn't been good enough to take care of Evans.
The Norwegian media has reported that there were 9 unexplained deaths in the hospital last year. And during the investigations into this young boy's death, the Norwegian Health Board has concluded, like you said now, his death was caused as a result of Akershus University Hospital breaking the law.
Yes. And
they have quoted specifically specialist health law paragraph 22. What do you say concrete on this?
The concrete is in the law is that if you are a patient in Norway, you shall get proper care. And they have said that, well, little Evans, he didn't get proper care during his stay at the hospital.
If the police, who have now decided to relaunch the investigations, because when the child died, they investigated and they called it off, do conclude now after the new investigations, because they have said they will start again, if they conclude that the crime was committed by the hospital staff, what do you think should happen?
Well, that's up to the police to decide, but I'm glad that the police now are investigating this case again. I think they did a mistake last time. They didn't start to investigate. I want them to look into what some of the staff up there has done and what they should have done for little Evans.
So the police investigated the same case last year and concluded that there was no wrong done by the hospital. Is that what you're saying?
No, as far as I understand, they didn't investigate so much last year. They just concluded that it was nothing to investigate. But the new report now from the health board has changed that. So the police now has asked the fylkeslegen if they should start a new investigation. And I think the fylkeslegen will tell them to start.
Now that, you know, the impact when the police investigate a case, whether for a short time and they conclude nothing wrong was done. And when they close the case, it can influence other departments to follow, because the police is respected in this country. So do you think the police in future maybe should wait before they conclude their cases and let the Norwegian Health Board to complete the investigation first?
Yes, this case is an example of that you mentioned. I think in this particular case they should have closer work together with
They should cooperate.
Yes.
Now, what I'm also thinking, this woman and the child, they are from Africa. They are from Kenya specifically.
Yeah.
And we know the police also have had problems in the past with foreigners in this country. Do you think there was some racism in the picture? I don't want to shout racism.
No,
here.
I don't think so in this particular case. But there has been some problems at the hospital because of the problems with the language.
Yes.
There has been problems for the child's mother to communicate with the staff.
But Norway people speak English.
Yes, but not everybody.
Yes.
And it says from in the report that due to the problems with the language could have influenced on this. But it's the hospitals. They have to get a translator if necessary.
Now,
so they are to blame if the problems is caused by the problems with the language. Then the hospital should have translations of everything.
so if the investigation uncover that there was negligence, there was crime committed by some people, do you think these people should be dismissed, or what do you think should happen to them?
That will be up to the police to decide, and eventually the court to decide what should happen.
Oslo, Akershus Director of Health, Dr. Peter Skau, he has also come strongly criticizing the hospital.
Yes.
Do you support
Yes, absolutely.
his views?
Everything he says in his report, I'm agree with him.
When you hear as patient ombud, you are to help these people who suffer. When you hear 20 cases, I read a report where it says there were 20 patients who were discharged, but they didn't get a follow-up. And
Yes.
some of them suffered
Yes.
grievous harm. What do you say to this?
The problems in Akershus has been there's been big problems after 1st of January 2011. Here in my office, since 28th of January 2011 and until today, we have had 400 patients and who's come to our office regarding problems with Akershus.
The Ministry of Health, the top political leadership, they represented by Permanent Secretary Robin Kos. He has commented also on this case, and he says he wants the report to be sent to the ministry.
Yes.
What do you think they want to do?
Hopefully they will look into the matter, both this case and some other cases, to investigate what went wrong, and is there someone to blame, and what can we do so this never happen again.
Yes. The hospital leadership, although they are now beginning to see sense in all this, they seem to be reluctant to bring closure to this case of Evans. The ministry and the health board have asked the hospital to come clean now. The reports in the media indicate that the assistant director of Aarhus Hospital, Stein Waller, is only prepared to submit the report by the 15th of November. Why the delay? What are they hiding?
I don't think they hide.
We are now in July.
Yes, but I don't think they have anything to hide in this case. But they have to report back now what they are going to do so this never happen again. And obviously they will use some time to look into this and to find out what they can do, what they have to do regarding everything. So this don't happen again. So it's not unusual that they get some months to get the answer back to the fylkeslegen.
The health policy spokesman of the Progress Party, right-wing party in Norway, represented by Mr. Peter Arne Olsen, he wants Aarhus Hospital to be investigated thoroughly.
Yes.
Do you support him on this as the way forward? Because now we have reports that the health ministry's political advisor, Tord Dahle, of the ruling Labour Party is against such investigation of the hospital. What is it that they want to hide?
I don't know, but I support that the police are going to investigate this, and the whole process. In the 1st of January 2011, Akershus did get a lot of new patients. At the same time, they didn't get any doctors and nurses. So, and it was the government who decided that they should take new patients.
Yes.
So I think someone up in the department maybe is to blame, and I want the police to...
In the ministry?
Yes, in the ministry. So I want the police to investigate what was going on then. Who did know what?
So you are saying that because now we forget the politics of competition, because we know in Norway that the Progress Party and the Labour Party, they never agree on some issues. It becomes politics, everything. You agree then, in principle, that the Progress Party spokesman on health is right, that the hospital should be investigated?
I myself have been out in the press and has said that I think the police should be investigating all what's happened, not just with Evans, but with all the other patients.
Finally, Mr. Tone, what input should Mother Wangui Kiru, the mother of this child, a mother in sorrow now, who have lost her beloved son, expect from your office and the Norwegian state?
Well, from my office, she will get the help she needs regarding the police and everything about that. We are also investigating if she will get any compensation from the government because of what's happened, and she will get help to investigate that.
Thank you very much, Mr. Tone, for giving us this interview.
Thank you.